When thinking about the potential connection between dietary therapies and reducing the risk for sudden unexpected death in epilepsy, SUDEP, I think there's a very direct relation. One of the most important risk factors that we know of for SUDEP is frequency of seizures and frequency of seizures that involve movement, so-called generalized tonic-clonic seizures. And the recent literature has demonstrated that it's the tonic stiffening component, more so than the clonic component, that may be the biggest risk factor. That stands on solid science. We also know that the ketogenic diet prevents those kinds of seizures in children. So although there hasn't been the study to look at prospectively in a randomized controlled fashion that ketogenic diet reduces risk of SUDEP, I think the circumstantial, the connecting evidence is very strong, and so that when asked about is ketogenic diet a important thing to do with regard to reducing risk, I answer yes. A major question now is when to start the ketogenic diet. And in many places, it is the treatment of last resort. In those situations, the outcomes are not going to be as good because it is the treatment of last resort, and you've already selected folks who are most resistant. But even then, you can get some wins. I think we're coming to a new age where the diet is going to be looked at sooner and sooner based on seizure type and epilepsy syndrome. For example, in GLUT1 deficiency, it is the treatment of choice. When we think about other syndromes, such as myoclonic astatic epilepsy, it's probably going to be the second or third treatment of choice. So I think what we're going to see is a stratified approach, again, based on newer clinical trials, which demonstrate efficacy, lower adverse effects.